Is everyone able to hear me? Is this okay? I'll have my phone here to just keep a little time so that we can wrap up in time for the reception. Um, I just, I'm so thankful for everyone that's here, for everyone who's been participating online. I'm very excited about how things have come together. If you don't know and have not been able to pick up on this by now, I am incredibly formally informal, right? So I know how to switch it on and be professional and be Dr. Richardson, but I find that I'm more impactful when I can kind of combine that with being my true authentic self and just having conversation. And so when I looked at the schedule for this year's event, I was like, we've got some powerful panels, powerful speakers. When it comes to closing session, let's just have a conversation again, right? So this is set up as a fireside chat, and I'd love for Melody to take a moment to just introduce herself, and then we're gonna talk.
That sounds good. Well, thank you, Dr. Richardson, for just all of the wonderful conversation that you have facilitated already today. I have so enjoyed hearing from everyone on the panels, including the audience members that have asked really thought-provoking questions. So I've already felt like I've had such an enriching experience today. I'm Melody Platt. I'm a licensed master social worker. I am affiliated with both the University of Alabama and the University of North Alabama currently. I am an instructor in the Department of Social Work at UNA, and then I'm also working on my PhD at University of Alabama, both in social work, and my general area of research interest that I'm focusing on is anti-racism.
Great. So what I'm looking for now is the clicker. Thank you. So we're going to jump into just some quick PowerPoints to give you a sense of our framework in regards to how we approach incorporating justice in the work that we do, and then we'll just chit chat.
Oh, handing it over to me. Okay. So I think framework is a really good word to describe what you see on this slide here. I feel like a lot of what's represented here has already been addressed in some form or fashion through the discussion that has transpired today. So that's really, I think, inspiring to see that we all can come together and bring our various perspectives and voices to this conversation and have a meaningful dialogue. So colonization, on the left-hand side here, you see these social determinants of justice. The left-hand column represents factors that bring us towards inequality, while on the right-hand side, we see factors that take us towards equality. So we've talked a little bit about the upstream, downstream effects, the legacy of oppression that has led us to the point that we are in time here today. So I'm going to take it all the way back to colonization. And as Dr. Richardson knows, I just spent a month in South Africa in May and got to see through a little bit of a different lens, another culture that has really been impacted by the ramifications of colonization. And then some other countries have been mentioned here today, Australia, Brazil. There's really so many countries around the world that have this similar shared history. And just to give a very brief overview of or definition of how I think about colonization, it's other countries, other geographical regions coming into some area and taking over. That's really a simplistic way to think about it. So in South Africa, you have the Dutch, you have the Europeans that all showed up and said, okay, we're here now, we're going to be in charge. And it's really striking to see in South Africa, particularly because white South Africans are in the minority of people that are represented within that country. Only 8% of South Africans are white, and yet own 80% of the wealth in the country. And so that was a very striking realization for me personally, just to begin to think about oppression and white supremacy and marginalization in a different way. It does not have to be enacted upon people that by the numbers are the minority. The ramifications and effects can extend far beyond that. So with colonization, that leads to disenfranchisement, and that's the denial of rights for people. And then within the U.S., that has led to segregation. Of course, during the early part of the 1900s, we had that enacted by policy and law mandated segregation. And though we don't have those policies present here today, we still see the de facto effects from those policies. And that was addressed as well by some of the other speakers today, that when the system has been set up and structured to perpetuate these inequalities, taking away that mandate does nothing to really rectify the repercussions that we've seen. And so all of those lead into social exclusion. And that's the term that I really rely on when I think about mental health disparities, really disparities in all areas of life, is that there are factors or facets of our citizenry who are being excluded from fully participating in all areas as what would be equitable. So we don't want social exclusion. On the other hand, towards equality, we have perspective taking, which leads into empathy, into advocacy, and into policy change. So perspective taking is something that I'm sure all of the mental health clinicians are very skilled at. It's something that I use as a clinician when I meet with clients, doing my best to try to really put myself in the frame of where they're coming from, whether it's somebody who has a lot of similarities to me or a lot of differences. Even though we may have surface level similarities, we never know somebody's true story or background until we ask. And then we, again, put ourselves in the perspective of where that person is coming from to the extent that is possible. So when we really make an effort to do that, that leads us into being able to develop empathy. And I use the term radical empathy. That's a term that I took from Terry Gibbons. That's the title of a book that she has published that focuses on bridging racial divides. So radical empathy is different from just empathy on its own, because it compels us to take some sort of action. So it's not enough to simply feel for somebody, but that compassion, that perspective should then compel us to do some sort of action on behalf of the people that we have empathy for. That leads us into advocacy. Advocacy takes a lot of different forms. We've talked about political activism a little bit today, as well as simply advocating on behalf of clients that we serve to access resources or services that they may need. And then all of that can lead into policy change. And again, we've talked about the federal, state, local level of policy, but also institutional level policy. And what we know is that policy is not always implemented the way that it is written. So we can advocate for changes, even in how the organizations that we're involved in go about implementing policies so that we can promote as equitable outcomes as we are able to do. Okay, so I'm interested in looking about residential segregation as a mechanism of perpetuating racism. I am somebody who really likes to look at what the underlying causes are. And there are so many multifaceted causes of racism, but residential segregation has been the closest I've been able to come, I feel, to thinking about this is the main thing. If we could change this, it would really make an impact. And so this is a quote taken from Massey and Denton, who wrote a book called American Apartheid. And again, that's drawing the parallel with South Africa and their political institution of apartheid, which is just extreme segregation, essentially. So this is the apparatus that really perpetuates racism in a system of racial subordination. We've touched on some of these already, so I won't go too in depth, but segregation leads to the social exclusion of Black communities through both racial inequality, concentrated poverty, and adverse psychological effects. And this is through geographic isolation, social isolation, and economic isolation. So I wanted to include this quote, and I appreciate the emphasis that Dr. Richardson has placed on allyship as a part of today's gathering. And this is something that has always inspired me in terms of how I approach that idea of allyship. If you've come to help me, you're wasting your time. But if you have come because your liberation is bound up with mine, then let's work together. And this is Dr. Lilla Watson. She is an Aboriginal artist, activist, educator, and that has always resonated with me in terms of this idea of, I also wrote down some other notes from listening to the speakers today, but this idea of interest convergence that Derek Bell wrote about in critical race theory, that the historical tendency of white people to only help when the interest aligns with their own self-interest. And so part of the work that I want to do is shining light on the fact that all of our interests are converged. We're all sharing this space together. It's in all of our interests to establish a fully equitable culture and society where we work together. And so that is a very inspirational aspect of the work that I'm doing. And so just wanted to give some resources if you're interested in any of those topics that I've just really kind of brushed the surface on. There's Radical Empathy, the book by Terry Givens, and then The Sum of Us, that was a popular book that came out recently, again, that highlights what racism costs all of us. And one of the really striking stories that she tells, or anecdotes that she mentions, is talking about prior to the civil rights movement, when segregation was at its height, a lot of the public swimming pools throughout the South actually drained their pools rather than integrate. And so that's just a surface level example of how nobody got to experience the joy of swimming in the public swimming pool because everybody was emphasizing trying to maintain that status quo of segregation. And so that is an anecdote that I think about quite often as a depiction of how we can think about our interest convergence. And then again, American Apartheid, Segregation, and the Making of the Underclass by Massey and Denton.
Thank you so much. So you could see why we invited Melody here, right? This is excellent, excellent stuff. And you also mentioned Derek Bell, right? With critical race theory, and his book, Faces at the Bottom of the Well is one, right?
Yes.
So these books are great, great books to read just to get a better, a strong foundation of these theories and concepts that we're talking about, and also specifically how they relate to mental health advocacy, right? And the equitable work that we're looking to accomplish through that. So as a professor, I actually really focus on cultural responsiveness and came up with a term called cultural proactiveness. And it ties very much into what you mentioned in regards to an upstream and a downstream approach, because cultural responsiveness really acknowledges the differences and understandings, and it defines people's experiences. So essentially, if you want to think about cultural responsiveness, it's responding to an inequity by making yourself culturally competent so that you can be that way in regards to your engagements, right? Cultural responsiveness and mental health advocacy tends to be very programmatic. So it is more of an upstream approach, right? You see a challenge, you address the challenge. You see a need, you address the need. And the work that we do, and especially when I'm talking about health disparities, some of the examples I might give in a classroom is a food desert, right? You see the need. The programmatic approach to feeding that need is to maybe have a food bank, right? So now the immediate needs of someone who does not have access to food is met. But cultural proactiveness specifically looks at the systemic inequities that create the environment that results in a food desert. So it really is focused in more of a downstream, upstream, approach of like, why is this happening? Why is there a food desert? The food deserts that exist in the Birmingham area often exist in lower socioeconomic communities, right? And again, referring back to the Place Matters study that I mentioned when Dr. Hicks was here during the opening session, when you look at why those things exist, it is redlining, it is segregated communities, it is remnants of Jim Crow. And so these aren't things that just happened overnight, they happened over time. And so cultural proactiveness says if we're going to actually address these things, we have to acknowledge the socio-historical and socio-political factors that created these disparities, and then address it now with new policy. Now, both of them should go hand in hand. We need the food banks, right? For us, we need free counseling. Free counseling is a programmatic intervention. The policy work of that is trying to understand why is there such low funding in going into mental health care within the state and across the country. What goes into the medical theories and concepts that are used to diagnose, and how are they culturally incompetent, and how do they actually contribute to the persistence of stigma in historically disenfranchised and marginalized populations. So we need to do both. You need the food deserts, but you also need the studies that highlight the underlying socio-historical, socio-political, and socio-cultural factors, really to get an understanding of how these things came about so that we could strategize differently on how to address them. Because programmatic interventions alone are a Band-Aid. They work and they're helpful and they meet immediate needs. But if that's all we're working towards, if that's the only approach that we have, then we're really not going to uproot the embedded systemic inequities that have been there for centuries. We're actually going to contribute to the persistence of them. And so when we're thinking about all of these things and thinking about justice, what I often find, and this is not just in my classrooms, but this is in community engagements, these are in committee works, is that oftentimes we focus on the programmatic things and don't talk about the cultural responsiveness things or cultural proactiveness things, because we have to use words like white supremacy. We have to use words like ageism, sexism, classism, homophobia, transphobia. We have to say these things. And if you're not comfortable talking about these things, then you shy away from them, right? But if we're really working towards justice and liberation, we have to call a thing, and we can do that without pointing fingers, right? We can do that without saying you're a racist, you're a sexist, you're a homophobic. We can do these things by just acknowledging that our bias is informed by environments that we were socialized into that contribute to a cultural lens that can be discriminatory, whether it's intentional or not. And we take those ideas and those concepts and that cultural lens into the work that we do. And if we don't address them, if we don't aggregate them, if we don't challenge them in any way, shape, form, or fashion, the good service that we believe that we're doing may not be so good. And so really when we're thinking about justice, we have to think about it in all these realms. I don't think I have to say anything to this population of people who are here. When you are treating someone in any way related to their mental health, you're going to have to acknowledge their environment, right? You have to know, do you have access to proper education? Do you have access to food? I can write an entire treatment plan, but what does that matter if you don't have access to a pharmacy, right? Do you have the ability to continue your treatment with me, or do you stop because you feel like you can't afford it? Are you employed? What's your housing situation like? Do you have children? Do you have the resources to support those children? In the environments here in Alabama, we have environmental justice work that's being done in communities. Oftentimes we have these separate conversations as though they're not all connected. But if we're really thinking about a mind-body wellness approach, we have to address the environment in order to work towards justice. And justice, essentially, I can't talk about, and I said this earlier, I think in a session, when you're talking about justice, you have to talk about liberation. Justice to just be talking about justice is not action oriented if it's not working towards liberation. And liberation has to acknowledge that there has been an inequity, and that inequity has to acknowledge that it's been informed by an ideology. And these are not easy conversations to have. Bless you. I'm kind of skilled at having them, if I do say so myself. But it's because I find it fascinating to see how people have been socialized to see the world, and what makes them so uncomfortable by talking about these very complex and layered issues. One of the things I really appreciate about you is the work that you mentioned in South Africa. The first conversation we had, really kind of the only conversation we've had, because it's our first time meeting in public or in person, is I was talking about the work that we did in Brazil. And so in 2018, the Black Women's Mental Health Institute had the opportunity to travel to Salvador, Brazil. And it was significant in the work that we were doing because Salvador has the largest population of descendants of the African continent outside of the continent of Africa, right? So it has the largest population of African descent in Salvador, anywhere in the world outside of the continent. And so it's really a unique mix of culture, African, just Brazil, like it's just beautiful culture. But we were there specifically to look at mental health in the experiences of Black women. We were able to go into homes and interview people. We interviewed artists. We got to go to a ballet and interview artists. We interviewed business owners. We interviewed a Brazilian beauty queen who had her crown stripped because the community that she was living in said that she was too dark skinned to be their queen. She was the carnival queen. And, you know, carnival's very big. And they stripped it from her. They said she can't have it because in that sense, the carnival, because of colorism, was always looking for a light skinned Brazilian to represent the carnival. She went on to be an artist, an entrepreneur, a fashion person. So she had a store that we were able to talk to her. We got to visit a mental health facility. And all of this was done in coordination with Vidas Negras Importantem, which is Portuguese for Black Lives Matters. And that's what made this exceptionally fascinating to me, because again, going back to colonization, the same things that Black Lives Matters was fighting for in Brazil, same thing here, right? It's the same, it's access to healthcare, access to education, access to housing, access to jobs, and the same kind of discrimination that they experience there. It's not exactly the same, but it's similar. And I'll tell you a story that one woman told me, and I sat in her living room with her mother and her sister, and she broke into tears, the example that she gave me. She said, I went to the bank and they wouldn't service me. And I just felt like I was so hurt. And I got on the bus to go back home. And there was a woman, a white woman, who did not want to sit beside me. And I was like, okay, Montgomery, you know what I'm saying? And then when I had the opportunity to interview a Brazilian ballerina, she said that she was referred to as a tar baby. I'd never heard that outside the United States. And I was like, okay, so this is a thing. So when we're talking about colonization, we're talking about racism in its various forms, but this is still us talking to women who are crying now, right? Because of these experiences they've had. Us also, because of cultural competency and cultural inclusion, for us, we had to learn that we can't just go into homes and have these conversations without acknowledging different spiritual practices that were put into place there that they relied on more so than a counselor, right? Because they didn't have access to counselors. So some of the more African spiritual practices that they were incorporating into their work, that was very valuable, and understanding that they relied on that more. With our work, with the Black Women's Mental Health Institute, we actually are very intentional about incorporating these different types of justice, right? Social justice, which centers on equality and strives for fairness. Disruptive justice, which is a term that I coined. So if you happen to like to use it, please make sure you reference Dr. Nadia Richardson. And it focuses on equity and strives for liberation, right? So social justice really says, okay, we're going to be fair. We're going to make sure everybody has the same thing. But if there's an inequity that exists and you give everyone the same, that inequity is not going to go anywhere, right? Disruptive justice says that we need to actually address why these things exist, right? And really disrupt the systems that contribute to the persistence of these inequities. And mental health care for us, in the work that we're doing, is specifically how are clinicians trained? We talk to clinicians all the time, and they talk about the required curriculum. And these topics aren't a part of the required curriculum. They may be available as an elective, but it's not a part of the required curriculum. And I can tell you, I've worked in schools of public health, schools of medicine, biomedical sciences, schools of health professions. And when I bring up these topics, they are considered not as academically rigorous. They're not considered as important and valuable. I've had faculty and professors say, well, what does this have to do with treating a client? I'm like, well, how do you expect to treat a client equitably? Well, we're focused solely on diagnosis. Diagnosis is even relying on models that aren't inclusive. So how are you really providing the care that these clients need? And then there's this new concept called healing justice. And healing justice, there's actually a book that recently came out. It's a term coined by the Kindred Southern Healing Justice Collective. I always like to make sure I'm saying the name right because it's a long name. But they are actually a collective of organizers, educators, and activists throughout the South. So this is the term that's really coming out the South. And it is considered a political strategy, right? It's focusing on acknowledging generational trauma, creating safe spaces for healing, but also making sure that a part of that healing is being actively engaged in bringing about change. So that's where it is a political strategy, is that, yeah, we're working towards these things because we know that these things are going to not offset, but acknowledge generational trauma and make sure that that trauma does not continue to be passed down from generation to generation. So it does require political strategy and political involvement. Well, I think we've already talked quite a bit about this, the continuum of systemic oppression, how systemic oppression and political determinants of health and social determinants of health are all connected. This is a big reason why we chose the theme of this summit. Another big reason is political determinants of health. And I have to acknowledge, I have to acknowledge Dr. He's gonna be like, she's forgetting my name. Dr. Brian McGregor, is he still here? He might have stepped out. So Dr. Brian McGregor is here today. He's with Morehouse and he's with the Department of Psychiatry and Behavioral Sciences. He's been a supporter of us for years, come to this conference several times. And the reason I bring him up is because Daniel Dawes is also with Morehouse, and he's done this work and written this phenomenal book that talks about the political determinants of health and talks about reasons why voting matters, why engagement matters, why we can't just continue to address things like health equity through programs alone and programmatic intervention. We really do have to get to the policy so it can uproot the factors that contribute to the persistence of those inequities. So this is another great resource that I encourage you to visit. And so I guess let's just chit chat. We have a couple more minutes. I'm very interested when you talk about anti-racism in your work. What does that look like programmatically as well as policy-wise?
Oh, goodness. That is a loaded question. I think that the solutions are multifaceted. And so it's difficult to come at it with just one solution. And we've touched on many of those today. Programmatically, you brought up some good examples in terms of providing resources, whether that be food banks, whether that be community programs, providing those resources to communities and populations that are cut off and don't have access to them, as well as when it comes to policy, getting at the root of the problem, as you said. So we need to investigate what are the policies that are perpetuating this system of social exclusion. Why do we continue to have segregated communities even after those mandates and policies that supported segregation are no longer in place? So I really like the emphasis that you place on being proactive. That is a word that resonates with me. We do not have to only have policies that rectify things when we're in distress. We can also have policies that proactively incentivize the outcomes that we want to have. So if we think about like our tax system, I'm no tax expert, but I can tell you that the policies that we have in place incentivize a man and a woman to be married, the man to be the breadwinner of the home, the primary income earner. If there's children, that's also incentivized. And so we can create policies that will lend themselves to a particular outcome, even if that outcome is not explicitly stated within the policy. So we need proactive policies that are going to support communities that have been excluded and historically marginalized. I hope that answered the question. Sure. I kind of trailed off in one of those multifaceted directions.
Sure. So a lot of this work is going to require an understanding of comparative histories, right? Mm-hmm. So really understanding not just the history of our country, but that we're not necessarily the blueprint. This is happening all over the world. And so because of that, I think, as a first generation American, right, I think oftentimes the United States can operate in a way where they are always the authority. But I believe that we can learn from each other. And there's work that's being done in other parts of the world where healthcare is available and is accessible, where efforts are being made even in political realms to acknowledge some of the inequitable histories that that part of the world may have experienced. And then there are others that are experiencing disparities like ours, that we can also collaborate and partner with. So the same way individuals can learn from us, we should be able to learn from others as well, because that's how we collectively work towards justice anyway.
So I like to add an example to that. You kind of jogged my memory here, but within my time in South Africa, they are so freshly out of apartheid. It ended in 1994. So I think of them as being almost like a generation behind where we are in the United States in terms of learning how to move in a post-segregated society. They're in this post-apartheid society. And they've really been exemplary in terms of acknowledging and attempting to reckon with the atrocities of the past in a way that the United States has notoriously is not good at. So we don't want to acknowledge, like you said, so many people are uncomfortable having these conversations. And I also am kind of bewildered by that fact, because anecdotally we look around and this is the reality we live in. This is what we see. So we should be able to talk about it. But in South Africa, they instituted something called the Truth and Reconciliation Commission. And this was an opportunity for everybody who had been impacted by apartheid to come forward and essentially in a setting like a hearing, be able to share their story, whether they were victims of the system or whether they participated as perpetrators in some form or fashion. And I feel like that really set the stage for healing to be able to happen. We've mentioned storytelling several times today, and I really believe that there is a healing element when we're able to tell our own story, as well as we can see the humanity in one another when we have an opportunity to hear about someone's experiences who has a life story very different from our own.
Absolutely. And I'm so glad you mentioned truth and reconciliation. There's actually a truth and reconciliation project that's going to be taking place here in Birmingham, and specifically as it relates to descendants of the foot soldiers of the civil rights movement. So if you're interested in learning more about that, I recommend that you follow the Ballard House. And if you're not familiar with the Ballard House, that's kind of one of those hidden histories. It's a house located in the Civil Rights District. Actually, it's not too far from UAB, rather. And it was the office, the practicing office of a doctor who took care of individuals who are part of some of the marches. So we saw the videos of the dogs being let loose on protesters. We saw the hoses and stuff. So this was actually a doctor who treated individuals who were harmed in those things and had the opportunity to work with Martin Luther King Jr. And so his descendants still have the home. They've turned it into kind of a space for teaching and learning and community organizing. So if you're interested in learning more about that project, I highly recommend that you reach out to them. So I've learned a lot about you and the work that you're doing. How does this for you all tie into social work?
Tie into social work? That's an interesting question. One of the main explicitly stated goals of social work is social justice. And as we said, things aren't maybe necessarily always implemented the way that they're intended to be. So just like every other profession, I think social work has fallen short of really obtaining that goal, but that is our stated focus, is we want to achieve social justice. So many of the concepts that we've been discussing today have really connected back to the core values and ethics of the profession, such as self-determination. So I've heard a lot of talk about really building that rapport and buy-in with community members, with service consumers, and amplifying their voices, allowing them to be involved when developing programs, and be a part of the decision-making process. Because as individuals, we know what we need in our own lives. As community members, we know what the needs of our community are. And so if you think about it from like a mental health standpoint, when you're designing a treatment plan for a client, if they believe that they need these things that you're offering and they need these services and resources, they're going to run after that and engage in it. But if you've developed a plan that doesn't connect with the needs that they see for themselves, that's when you might find non-compliance, or, as you talked about, not having access to the resources needed to fulfill, to fully participate, transportation, access to a pharmacy, whatever it might be. So I think that this quest for social justice really ties in well with the values of the profession. And then often I get asked as a white woman, like, why do I care about this? What is my interest in this? And so I had to do a lot of self-reflecting to really connect to what that reason was for me. And what I came up with was my personal story of being adopted as an infant. And so I had kind of like that break from my biological ancestral history, and was raised in a white family. But I always wondered about, like, who are my people? Who do I belong with? So I feel like I had an openness to connect with other people, to learn about other groups without that really strong sense of us versus them, social identity group. So I think that's part of what drew me into being interested in these areas.
Sure, absolutely. For our organization, one of the things that happened at the height of the Black Lives Matters movement is we saw an uptick in the individuals that were engaging us for support. And it did not discriminate in regards to academic achievement, socioeconomic status, even regional, wherever you were located. What it was were Black people who were in distress, Black people who were going to work, sometimes in environments where they were maybe one or two of the only Black people there. What we saw were young students who were going into school and felt like they were having to explain why they were sad to people who just didn't seem to understand why they were so upset. We saw the rise of suicidal ideation for individuals who were watching police videos constantly on the news and experiencing symptoms that were in line with PTSD. We saw vicarious trauma, a lot of that happening. So even though you might not have experienced anything related to any negative engagement with a law enforcement officer, being exposed to so much of that, inciting fear and anxiety and sadness. For us, really, justice in all of those spaces is why we felt like it was important to mental health. Because when you have injustice, it gives rise to mental health distress. We also, one of these conferences, the theme was no justice, no health, right? So in the same way we say no justice, no peace, one of the themes of our summit was no justice, no health. And we specifically talked about the need for environments to be inclusive, equitable, and just, because if not, you're constantly having to respond to the ways that impacts your mental and holistic well-being. Also, a big part of that is in the advocacy work we do. Say a mother comes to us and she's experiencing anxiety and fatigue and stress and depression. We can certainly provide her counseling. We can make sure she has all the therapy she needs. But if she's going back into an environment where her kids are in a failing school system and they're not going to be prepared for higher education, much less the workforce, if she is going back into an environment where she doesn't have proper transportation, but perhaps she's a single parent in the house, a single mother, and she's having to work, and so now she's taking an excessive amount of time to get there and get back. If she is still working hard to make ends meet because maybe her job is not paying her enough, it doesn't matter how much therapy we give her. She's not going to be mentally well. She is going to be anxious. She is going to manage depression. She's going to have a difficult time trying to balance life and take care of the responsibilities she has. But a lot of those conditions, again, social determinants of health, are impacted by political determinants of health, which again is one of the reasons we developed the theme for this summit, is to talk about all of those things are connected. I often tell my students, I'm teaching classes right now this summer for students who are going on to careers in healthcare. They're interested in being nurses, doctors. Some of them are going to hospital administration. And one of the things I very regularly stress to them is, yes, treat your patients. Yes, identify their symptoms and diagnose. Yes, do all of that. But providing truly culturally competent care means that you have to be very aware of what's going on in the community that you serve. So if they're not going to be here, if they're going to move to another state, or if they're going to move to another part of the state of Alabama, step outside of your clinic and find out what access your patients have to pharmacies, what access they have to healthy foods, what access they have to proper transportation. Because if you don't, you're constantly going to be writing prescriptions and treatment plans that maybe your patients don't have the ability to adhere to. And so that's a big part of how we approach our advocacy. We can provide you free therapy all day long, but we want to know about what your communities are like and what the barriers are that need to be addressed, so we can be a part of bringing about that change. We're a mental health institute, but you might see us at a school board meeting, right? Mm-hmm. We're a mental health institute, but we might be at a city council meeting. We're a mental health institute, but we might be engaging national organizations that create the curriculum that licensed mental health professionals need, because we're interested in making sure that our clients have access to culturally responsive clinicians. So the work that we do doesn't start and stop within providing therapy. It's really addressing the world and making sure that the world is just and equitable, and that the environments we live in are contributing to our mental health and not distressing it. So I think we have time for just a few questions. I have fun doing these things. I think it's very interesting, but we really did want this to be kind of a fireside chat. So if we have time for a few questions, if anyone has any questions about some of the things we talked about. Any questions? Are there any? And if there are any questions virtually, how have you enjoyed this summit so far today? Good. I've enjoyed it too. So if there aren't any questions, do you have any closing thoughts?
I have one thought I could add. We've talked about being culturally proactive, responsive, competent. I'll throw one more word out there in the mix, and that is cultural humility. And that's a move within the social work world that we're heading towards, this idea of we can't ever really be fully competent in cultures that are not our own. And so we need to approach each environment, each client with this element of cultural humility and awareness that our way of seeing the world is not the only way, and it's not the way that should be. Having that sense of humility and honoring the elements that each individual person brings to the table. So that's a word that also is resonating with me right now.
Okay. And so, yes, please.
I have a question. So us being 50 out of 50 in the access to mental health care, and looking at that political determinants of health chart that you had up there, that's our voting, that's our government, that's our policies. But I've never heard this raised on the campaign trail. I never heard this raised in a town hall meeting. And this issue impacts so many other areas of quality of life. And I'm thinking in my head, how do we speak truth to power and do something to do a systemic change in Alabama? What are you all's thoughts on next steps for changing this being 50 out of 50 and making some noise and holding our political leaders accountable?
Sure. So I can tell you, we engage a lot of elected officials, and actually have gotten a strong amount of support from city council members here. Of course, the mayor that was here earlier. And you saw the first panel, and we've gotten some support from state representatives, and have a wonderful relationship with Senator Marika Coleman. But I will tell you, we've also spoken at a congressional briefing in Capitol Hill in Washington, D.C. What I often find in speaking with elected officials, just think about the day-to-day life and responsibility of elected officials, right? So they've got a lot going on, and they almost have to know a little bit about everything. What I've often found is they don't know this, right? They just don't. But as soon as you educate them, they put it in, they go to work. You know what I'm saying? So a lot of what we're doing is engaging elected officials to talk about mental health, right? Because really at the baseline level, some elected officials aren't familiar with mental health. You heard Senator Marika Coleman earlier today say that she didn't even have a full understanding of it until she had some experiences in her personal life. So I think that's a lot of it is educating elected officials on baseline definitions related to health, specifically for us, mental health, and then larger kind of concepts of this. Because this, again, it doesn't matter if it's an undergrad class, a graduate class, a medical school, or me training faculty, this kind of stuff is oftentimes they're like, I've never heard this. You know what I'm saying? So there's still so much need for education. And in order for us to bring about those policies, it really is up to us to educate our elected officials. And they're open to it. They're very open to it. Because it adds to their platform and it adds to the laundry list of other things that they want to do, but it also provides them with strategies and avenues and community support for getting those things done. So don't believe I cold call the congressional briefing that we spoke to. I'll tell you how that came about. I was in DC. I used to live in DC too. I was in DC for maybe a conference or something. And whenever I go to DC, I'm like, who am I going to cold call today? Right. So I did this whole email blast to different congresswomen and men, and waited to see if I heard back from anyone. I heard back from one person. I got to meet with her. It was Congresswoman Robin Kelly. I got to meet with her health policy advisor. That was 2017, maybe. I still have a relationship with them to this day. You know what I'm saying? So you just call right. All of the elected officials that were here in the first session, when we closed and, asked them to make some closing statements, every single one of them said, my email is online, my phone number is online, reach out to me, schedule a meeting, let's have a conversation. And when you do that and they know who you are, then they'll put you I don't want to say put you on the map, but they'll put you to work because your work is helping their work. So that congressional briefing, what ended up happening is we met with them, we told them who we are, what we're doing. At that time, we were doing some advocacy work with a family out of California whose daughter, who was living with a bipolar diagnosis, was shot and killed by police. So I'm sorry, let me take that back. We were doing advocacy for another family. And we talked to them about training law enforcement officers. We talked about the Black Lives Matters movement. We talked about all of those things. What ended up happening is we flew back to Birmingham, literally landed. You know how you have to turn your phones off? Landed, turned my phone on. And as I'm getting off the plane, somebody's like texting and calling. And I'm like, oh my gosh, what happened? And I picked it up and she was like, did you see what happened? Did you see what happened? And this is when we found out about the family in California. And I was like, this is exactly what we were just talking to the Congresswoman's office about. And so I, walking out the airport, called the Congresswoman's office. And I said, hey, did you see this? And she said, yeah, we saw it and we were just talking about you. And so that led to an invitation to come back and be a part of the briefing that they were hosting that spoke to the mental health of Black women. Sometimes I don't want to say it's that easy, but literally cold calling someone, emailing someone, asking for an informational meeting can build relationships with elected officials that can bring about that kind of change. Any other questions? I appreciate y'all so much. Thank you so much for being here. It's a long day, but it's a fruitful day. I hope y'all appreciate it. So what I'd like to do is close it out on a really big high note by doing some giveaways and then welcoming you into our closing reception so you can take some of this food home with you. So I'm going to call some names. These are things that we do often. Is Crystal Cummings here? Hi, Crystal. So you were actually the first person to register for the summit. So we would like to present you. Then I'm very interested in who traveled the furthest to be here. Throw out some states, because we did have some people travel in. These ladies. New Jersey. Anyone else? And nobody's got this.
Baldwin County.
New Jersey has it. New Jersey has it. Now, do we have a mayor for New Jersey? Okay.
Is your first time in the South?
In Alabama.
Well, welcome to Alabama.
Do we have a Mary Miller here? She may have left already for the day. So I never take for granted anyone who supports us in any way, shape, form, or fashion. And Mary Miller right now is one of the very few community members who is giving every single month. And it's very impactful, it's very encouraging to us. So when you see these little charts out here, please donate. Any amount is small. With Ms. Miller, we are very thankful for the $15 that she donates every single month. Because for us,
That pays for our sister support groups, meetups, for Zoom, because we do virtual, so that pays for something, so yeah, that's awesome.
Absolutely. And as we're closing out, I encourage you to stay for the reception. We're going to be presenting some of our sponsors with certificates of appreciation, but just again to highlight who they are, Sanford Office of Diversity and Intercultural Initiatives. The director of that office is here outside. You'll hear from her briefly. Pharma, who is here with us, thank you so much. The Center for Black Health and Equity, the UAB Minority Health and Health Equity Research Center, that wants to remind you all that COVID is still a thing, still very much a thing. So you'll see hand sanitizer and all of these things around here, and it's because of our relationship with them, and that we don't ever want to get too comfortable. We want to be very diligent about the things that we can do to keep ourselves safe, as well as our community safe. Of course, Children's of Alabama and their Psychiatric Intake Response Center, thank you for always being a part of our work. And then the Jefferson County Department of Health and their Jefferson County Health Fund, which is done in partnership with the Community Foundation of Greater Birmingham, was also a huge sponsor of this event. So thank you to all our speakers. Thank you for everyone who is here. For those who are receiving CEs, they will be emailed directly to you. We invite you to stay and please have some of this food. And thank you for being here.
Wait, Dr. Nadia, you done gave bad instructions. That is not how this go.
Okay, well, then tell me.
That is not how this go. So for those who are receiving Cs, please make sure that you do all the surveys. I know somebody was like, oh, there's not a survey for this. So Dr. Nadia Richardson's session, the last session, does not have CEs, but all the other ones do, including the one prior to Spill Your Tea. So all of those are CE certified. So that's how you get your 7 CEs. So you actually did 8 sessions. It didn't feel like it, but you did. In order for you to get your 7, yes. Okay. So what you do is make sure you do those, and our company will send out those surveys again just in case you missed a survey to scan. So you can do those surveys, and then they'll send you the final survey. Y'all know the final survey, like the overall conference survey, and then you'll get your Cs. After you submit that, she should send you your Cs. So if you have any questions, let us know about CEs. I know it's renewal season. I know. I got you.
Okay, so, and before we walk all the way away, I encourage you again to take pictures outside. We've got a great backdrop. I've seen some people taking pictures. Post it on social media, tag us, let people be aware. This is an event that's constantly growing. Thank you for being a part of our first event back in person since the pandemic. Also, keep following us. We're going to be doing some really great work. When I talked about our relationship with City Council, Councilor LaTanya Tate has pledged now. Initially, it was $30,000, then it went to $40,000. Now she's like $100,000 to do work in the community. And then, Pro Temp has actually, Crystal Smitherman is actually in discussions with us to have an even larger gift to do this work in Birmingham and across the state. And so I really encourage you to stay abreast of us and the work we're doing, and also the partners nationally and locally who are supporting us. The Southern Black Girls and Women's Consortium have funded us for the past couple of years. And as soon as you said New Jersey, I was like, is that Focus for Health? So Focus for Health Foundation that traveled here to be with us today. Let me tell you how this story goes. So I get this email, and then I'm like, oh, I don't know who this is. And she's like, Focus on Health. So I'm like, oh, they must be an advocacy group doing health disparities work. Great. So she says, can we schedule a meeting? Perfect. Schedule a meeting. Tell us all about who we are, what we're doing. It's more of an informational call. And then she tells us, what they do and what they're about. And then they fund. And I'm like, oh, they provide grants. And I'm like, great. I can't wait to apply for a grant. And she said, you just did. And so they've given us a 2-year grant to do this work. And we're super, super excited. To us, it was like so affirming and so beautiful. And so we thank, and you came here, you know, so we're so thankful for you to be here, so grateful. And I hope you found it impactful and that you learned a lot. And you can see now firsthand what your work is going to support. So thank you so much. And that was great.
So before we go in, just FYI, I know y'all been talking about the counseling center. So our clinical director of remote services want us to remind you that we have 2 tracks. We have an LMFT track. So that particular track specializes in family and couples, right? So MFT, marriage and family therapy, for the non-clinicians in the building. Because Nadia was like, tell her what it is. She know now, so she excited. So just to let y'all know, we don't just see individuals, we see couples and families as well in order to support that track as well. So, and we see ages 10 and plus. So if anybody sees anybody below the age of 10, please come see me, please, because I have 2 clients I need to send your way. Other than that, we're gonna play some music and keep it moving.